Hi friends, in this video I will be discuss about movement disorder. Movement disorder. I will discuss about 10 type of movement disorder. 10 type of movement disorder. And in last I will show videos because it is very important nowadays in the NEET PG exam or INICT exam, the video based MCQ directly asked. So 10 types are movement disorder. First one is Parkinsonism. Parkinsonism. How you will identify a patient with Parkinsonism? The patient will present to you with resting tremor, resting tremor, and rigidity, bradykinesia, very slow movement, bradykinesia, and postural instability. Okay, so Parkinson's patients present with resting tremor, rigidity, bradykinesia, and postural instability. Second type of movement disorder is tremor. So tremor are mainly three types. First one is resting tremor. Second one is intentional tremor. Third one is essential tremor. So resting tremor present in the Parkinson disease, and intentional tremor you will see in cerebellar lesion, and essential tremor mainly you can see it is usually bilateral, and it is mainly improved with alcohol intake. So it is essential tremor. So third one is chorea. What is chorea? Chorea is irregular dance like movement. Chorea is dance like movement. Chorea is a dance like movement that is irregular dance like movement, that is chorea. So what are the causes of chorea? Chorea you will see in Huntington disease and rheumatic chorea. Okay, so next type of movement disorder is dystonia. What is dystonia? Dystonia mainly it is a sustained muscle contraction causing twisting or repetitive movement. A patient generally present in the emergency department with cervical dystonia. Okay, so dystonia is sustained muscle contraction which causes twisting or repetitive movement. Okay, dystonia can be focal or generalized. Okay, dystonia can be generalized or focal. So focal dystonia, as I told you, cervical dystonia, and sometime you will see generalized dystonia. Okay, next type of movement disorder is myoclonus. Myoclonus is usually sudden and brief shock like jerk. Myocardial is usually jerky movement which is sudden and it is for very short duration. Okay, and myocardial sometimes it is physiological and it can be pathological also. Okay, next type of movement disorder is tics. What is tics? Tics is also sudden but it is repetitive. Sudden repetitive movement, non-rhythmic motor movement, or vocalization. Okay, so tics, it is a Tourette syndrome. Okay, tics seen in Tourette syndrome. Okay, next movement disorder is ataxia. What is ataxia? Ataxia is uncoordinated movement. Okay, it is mainly due to the cerebellar dysfunction. It is ataxia. Next type of movement disorder is akathisia. What is akathisia? Akathisia is mainly feeling of inner restlessness. Okay, mainly seen in the antipsychotic use. Okay, next type of movement is hemibellismus. Next movement disorder is hemibellismus. What is hemibellismus? Hemibellismus is usually unilateral. Okay, and it is also sudden. Hemibellismus is sudden wild flinging movement. Sudden wild flinging movement of one side of the body. Mainly, usually, it is the limbs. Okay, so what is the cause of hemibellismus? Cause of hemibellismus is due to lesion in the subthalamic nucleus. Lesion in the subthalamic nucleus. Okay, mainly seen in the post-stroke patient. Okay, so next movement disorder is athetosis. What is athetosis? Athetosis is slow writhing snake-like involuntary movement. Okay, especially hands, fingers. So athetosis is snake-like involuntary movement. Okay, what is the cause of athetosis? Cause of athetosis is mainly associated with basal ganglia damage. Okay, these are the movement disorder. Okay, and it is very important for your exam. So I will show the videos of this.